They have made a decision to target me, which I believe is what it has been calculated and malicious. They haven't just done it through a fair process. They've tried to bring in other organisations. They've sent emails to organisations discrediting me or trying to find fault that where there isn't, a phishing exercise, as you might say. It's a waste of time for a funded organisation. Every step of the way, they have attempted to impact me or the process. What I have uncovered is that the NMC and the CQC are collaborating in this attack. The NMC have also brought in other organisations along the way. They have tried to find information out that doesn't exist to discredit me, and I have whistleblown on a number of organisations, and I'm pushing for a public inquiry into these organisations that include the NMC and the CQC.
Ishbel has been gaslit from the start of these proceedings. Every time that she's tried to make contact with the NMC, she tried to have her hearings in a fair and equitable manner. She's been messed about with dates, she's been messed about with timelines, she's turned up to hearings, there's been no disclosure from the other side, she's been given things at late notice. She's found out that there's been collusion behind the scenes between various bodies who are supposed to, during processes that are supposed to be handled in a much more professional manner. That hasn't happened. They've spoken to her clients, and she's fought at every point to try and find out what is going on, and has been hit by brick wall after brick wall. There's no transparency, there's no accountability. It's just not acceptable.
It's quite typical, unfortunately. I can't put myself in her shoes, but I see a lot of people in her situation experiencing the same situation as she experiences.
It's been really impactful both on my mental health, on my physical health, and on my business and my family, because it's an exhausting process. And as one person fighting a huge organisation that is protected, it's hard and frightening, physically frightening at times. You're living in a constant state of anxiety, a constant fear. Some of that's rational, some of it's irrational. There's that sort of anxiety that they could walk in at any moment, they could accuse you of anything at any moment, because it feels like that is their MO. Once they are in a process of wanting to prove that you are wrong, then they will stop at nothing. So there's a constant state of anxiety, which obviously means to say you can't sleep properly, you're not eating properly, you're not being able to be present with your family. You're trying to support a business and your staff to make sure that they feel safe and the patients within it. But, you know, at the heightened times of this, where letters are being received or I'm reading things, then, you know, I'm having nightmares, I'm not really wanting to go out of the house. There's a huge impact.
How she's being treated by a major organisation for simply trying to tell the truth about something and raise something, and that the structures that organisation and seemingly coming down so hard on it and potentially trying to destroy her and destroy her career and destroy her life for simply speaking truth to power. And that terrifies me, and also that's why obviously we fought so long with so many other people for the Hillsborough.
Ishbel is one of hundreds of nurses who is currently suspended whilst awaiting fitness to practice hearings at the NMC at huge personal and professional cost. Since 2016, there have been 33 registrants who've died by suicide before their case has come to a conclusion. The recent PSA, Professional Standards Authority report, has shown that the NMC has not met 11 out of 18 of their standards. Most importantly, standard 15, which is the standard that looks at the fitness to practice timelines, has not been met since 2018, which is quite frankly astonishing, and how it can be okay to put people through this process at the cost that it does, it is just abhorrent.
If nurses and midwives are taking their lives whilst they're undergoing FTP, then, you know, one life lost that way would be horrendous. You know, we're now seeing on average, you know, I think last year it was 6, this year it was 5. Since 2016, we know of 20, well, with the 5, it'll be 32 nurses now who've died by suicide before their cases have completed. You know, it's got to stop. We've got to do better.
The NMC themselves have recently commissioned a report to look at their own whistleblowing practices, and have not disclosed that report, and in fact have recommissioned the report at great expense. And that leaves a lot of unanswered questions. What's in that report? What's in those findings? We know from contact with the whistleblower involved, who's spoken to the author of the report, that in fact those findings are there and they're ready. So what has the NMC got to hide?
You know, we're talking about, you know, nursing and midwifery. Now, if they're not learning from mistakes that are getting flagged up and trying to bury the truth, well then the service won't get better, it won't improve. And I think that's reflected by some of the reports that are coming from Parliament, you know, on the performance of the MC. And then as you start getting deeper into this, you know, other whistleblowers coming forward who are facing similar predicaments, and that's just wrong. You know, that's a state institution that's just shutting doors down and not willing to learn, and that really worries me and really scares me. And that's something which we shouldn't countenance, certainly both as a country and also from a parliamentary perspective as well. So that's why I think this is such an important example. You know, I'm glad it's been raised, I'm glad you're working on this, and I'm glad Ishbel's getting the support which she absolutely deserves.
I think they've got so far away from what their purpose is, what their sole purpose is. They've forgotten what they're supposed to be doing. Yeah, and they've I think it's just completely lost their way. But they've had enough people telling them this. They've had Rise Associates, they've had Anthony Omu from the GMC tell them and give them reports. They've had multiple reports for which, again, we've paid for. But do they really have an appetite to change? We're not sure they do, because nobody's saying you've got to change and you've got to do it by this date.
In this country, we need an Office of the Whistleblower. We need more transparent systems to allow whistleblowing to take place. If you don't work for an organisation such as the NMC or the CQC, it is incredibly difficult, and there are a huge amount of barriers in place to prevent you from whistleblowing. And Ishbel's had a really difficult time in trying to do that right from the beginning.
It's supposed to be about assessing whether somebody today, if they were going to go to work tomorrow, that they would be fit and proper to work. It's not supposed to be about punishing for mistakes in the past. It's supposed to be about, you know, how can they demonstrate that they're fit and proper now.
Ishbel is a nurse. The NMC are there to regulate her, but they are there to support her, and they are a public body. The fact that they are allowed to treat her in this way, and the fact that she has found whistleblowing so difficult, and the fact that when she's raised her head above the parapet, and this has been incredibly difficult for her to do, at every turn, there's just been wall after wall, barrier after barrier, and they're just trying to knock her down. And it's to her credit that she's carried on, and she is one of hundreds and hundreds of nurses and registrants who are subjected to this process by the NMC. Years and years of waiting, hearings delayed at the last minute, the night before when you've travelled down to London, you've made family arrangements, and during this entire process, she cannot practice, she cannot continue with her clinical practice. The knock-on effect of that, as we've seen by the tragic deaths by suicide that have taken place, it simply cannot be allowed to carry on.
How the process is at the moment, it's about a referral comes in, and the NMC will probably tell you otherwise, but from our experience, you're referred, the referral's taken as face value, and everything about that referral is handled in order to see whether they can prove that referral or not and demonstrate that there is areas of concern. It's not done from a neutral standpoint at all, which is, for me, really, really scary, because I know that if I was a member of the public referring into the NMC, I would be hoping that they would be looking at my concerns and everything around it in a neutral way and in a professional way to determine what the risk was and what had actually happened. And what seems to happen is it just seems to be a legal process where the lawyers get involved and work out whether they can prove what's being accused or not. which does nothing for patient safety, and it certainly does nothing for registrant safety.
The PSA who govern the NMC is a government body. So what is happening here? Where is the transparency? Where is the accountability? They are behaving in a way that is secret. It's not allowing her to get the answers that she needs. And she's just going around in circles.
It's all about how we make things better and not this continuous state reflex, which is covered up, shut down, no transparency, no accountability, and it's done us no good. You know, and I've stood on Parliament on many occasions now and reeled off cover up after cover up by the state and its bodies, and it's got to end.
You're putting practitioners that need to be in the workplace because of their experience, you're removing them, and yet people that are not behaving as they should are continuing to behave that way and getting away with it. So the process isn't working.
Who is going to hold the NMC to account? This is not okay. The PSA have said it's not okay. The Department of Health and Social Care are starting to take notice, and as far as I'm concerned, we are approaching public inquiry territory.
I think there's definitely grounds for it. I'd be super interested when they get back to Parliament to have a look at what's happening and the scale of what we've seen, and also the tragic deaths, you know, of people that have been involved in this process. So it's something I think Parliament should be looking really closely at, and certainly the Health Select Committee, yeah.